We're beginning to hear concerns from some patients following the announcement of layoffs at several Marshfield Clinic locations.
Of the 222 positions listed in the public notice was one very specific title that hit a community of people with a rare disease. 7 Investigates' Emily Davies explains in a story you'll see only on 7.
Many positions on the WARN notice filed with the Department of Workforce Development are fairly generic titles like nurse practitioner, but one title stands out: Coordinator, Treatment Center for Bardet Biedl Syndrome. There's only one person in that role, and the people she fights for are now fighting for her.
When Bradley was born, he tripled his weight in 3 months. He was born with a 6th toe, very unusual.
He was just different, and his vision was starting to get really bad.
That's the first time I heard BBS.
When your child has a rare disease, you do anything you can to get them what they need to be healthy and thrive.
Be able to get those early diagnoses so that they can get those early interventions like Braille and mobility and all of those types of things.
The Bardet Biedl Syndrome Foundation notes the disease impacts 1 in 250,000 people around the world. In North America, there are only about 3,000 people. But there haven't been many resources or even a good knowledge base for families for many years.
He was born in 1992. It wasn't even a thing yet.
Fighting every day, IEPs, teams.
The parents are the ones educating the doctors.
Then one nephrologist or kidney doctor working in Texas encountered his first patient with Bardet Biedl syndrome.
I became aware of the need for a specialized program led by physicians and nurses and staff that really understood the condition.
By the early 2000s, Dr. Bob Hawes sought out working at Marshfield Clinic for its small town community and renowned reputation for excellence in care. He pitched the idea of filling that BBS gap.
At first there's apprehension because there's something completely new to the clinic, but I received the support of the leadership. They were fantastic.
By 2013, they opened the Bardet Biedl Syndrome Center of Excellence inside the main Marshfield Clinic campus. The center pulled together all of the specialties the patients needed to see who also understood this rare disease.
That's the one place where we can just, we have people fighting for us there.
We're the only center in North America that provides care for Bardet Biedl syndrome.
That's Dr. Hawes in 2019. By then, his team was well established, including a coordinator for the program.
Sonia is a critical team member.
That's how we met Sonia.
We touched base with Sonia.
Sonia, the other angel.
She's the coordinator of the program, but she is so much more.
Sonia Suda coordinates schedules, helps with travel plans, manages health insurance from everywhere to allow patients to see all the doctors they need in 1 week, which means a lot whether families are coming from a neighboring state or other territories.
Not only money, it's just that Wisconsin's really far and the travel will be really rough.
We get to do what would be 12 to 14 separate appointments, all in 4 or 5 days. We stay in Marshfield, we bond with these families and with these wonderful doctors.
Physicians would never be able to do it. I'll speak for myself. It's just beyond what we could do because we don't have the time to do that.
She notifies families about clinical trials. That work helped recruit patients like Zach Paff for a drug trial to address patients' hunger, which got FDA approval this summer.
He's lost a ton of weight. He's doing great. Now he's waiting for a clinical trial for vision, for gene therapy, because he's legally blind.
And Sonia helps families with just about anything in between.
I could finally relax, knowing I had Dr. Hawes and Sonia.
Dr. Hawes retired last year, but he says he set the program up for longevity. He says that includes having doctors and scientists to take his place and a coordinator, Sonia, that would keep the clinic moving forward.
I'm quite sure that the Center of Excellence would disintegrate without having Sonia involved.
We don't have anywhere else to go. I know they have to cut. This is a budget issue, but they cut the wrong person.
We tried reaching out to Sonia, but did not hear back. Marshfield Clinic declined an interview, but told us through emails and a statement that the program and the coordination of it will not change. A nurse that has been coordinating the special needs clinic for several years will be taking on Sonia's duties. Quote, it aligns caregiving coordination across all of our programs for children and adults with special needs. This would include approximately 40 patients we see in clinic yearly with the BBS program. We have amazing staff led by 3 providers who are BBS specialists. specialists, as well as coordinators with extensive experience and who work with hundreds of children and adults annually with special needs. That care will expand to the BBS Center as we continue to build on the program, end quote.